This is an obstetric scan with you are seeing that the placenta is fundal and grade 2. Okay. Now when I come down, let it down, थोड़ी सी सीधी कर लो towards the urinary bladder. This is the urinary bladder, and here so fundal region, placenta grade 2. And there is, you can see that the fluid, amniotic fluid, is more than expected normal. We do see a membrane, a floating membrane. The other placenta, this is a twin pregnancy with other placenta seen with the anterior wall. This is the anterior wall placenta. This is anterior wall placenta, and you can see that the amniotic fluid, you can see, is more than expected normal. Now this is the fetal body in transverse section, and this is the fetus number 1. Why? Because this is the one that is close to the cervical canal. Because we label it in a way that this is the urinary bladder, this is the cervix, closed os, and this is the body of the fetus. So the fetus that will be closer to the os, the cervix, we will label it as fetus number 1. Now in this fetus, we don't see, this is the vertebra, this is the umbilical vein, and here you can see a kidney shadow in transverse section. This is the kidney. This is the and in this fetus, if you see the head, it's cephalic in presentation. You can see the dilation of the ventricles. Here we are. This is a case of hydrocephalus. First baby is showing hydrocephalus with loss of cortical mantle. There is only small amount of mantle seen in patches. Otherwise, this is the skull bone, and this is the fox cerebri, and these are the dilated ventricles. This is the dilated ventricle. So this is a case of hydrocephalus, that of the first fetus number 1. Rather, we will say like this, okay. I have taken, before taking this video, the measurements. So we cannot rely on the measurement of the head of the first fetus, but the second fetus shows BPD of 5.5. The abdominal circumference of almost both the fetus is plus minus 190, and the estimated fetal weight is 904, and the gestational age is 23 weeks. This is the neck region. Here you can see the cardiac activity. Okay, now the cardiac activity is in the range of 150 beats per minute with regular waveform, that of the fetus number 1, which is the one closer to the, so it's okay. So the heart is normal, the size of the chest is normal, the neck is normal, this is the femur, and in longitudinal view for this fetus, see the urinary bladder. This is the urinary bladder, and this is the hand of the fetus. These are the eye. This is the eye. One eye, and now the second one. These are the two eyes with dilated ventricles and fox cerebri. I am intentionally changing the direction of the probe to show you what we see. Now this is what makes this case study as a that of twin pregnancy, and that is the transamniotic membrane. This is the transamniotic membrane that is suggestive of twin pregnancy or multiple pregnancy. So now I will move towards the upwards towards the fetus number 2. That is away from the fetus number 1 towards the fundal region, and this is the head of the fetus, that of the second baby, fetus number 2. This is the head, skull, fox cerebri, thalami. This is normal. So fetus number 2 is normal as far as skull and brain is concerned. Okay. These are the facial features, that of this fetus, and this is the mouth, eye, this is the eye, this is the lens, this is the nose, lower mandible, and this is the transamniotic membrane. This is the placenta, the umbilical cord. This is the umbilical cord. Placenta is anterior wall for this, and we can see two arteries, one vein, normal. This is the placenta for this fetus. These are normal. This is the heart of the second fetus. You can see the vertebral column, that of the second fetus. This fetus is also cephalic. You can see the stomach bubble, this one. No. This is the stomach bubble. Excuse me. This is the stomach bubble. Yeah. And we don't find any pathology relating to the fetus number 2. This is the transverse of the fetus number 2, abdomen. This is the transverse with transamniotic membrane. This is the abdomen in transverse section, and this is the transamniotic membrane. This is the transverse section of the abdomen of the fetus number 2. This is the head of the fetus number 2. And this is the placenta for it. This is the amniotic fluid, and because this is a twin pregnancy, it's not unusual to see more fluid in such pregnancies. So no defect, focal defect seen relating to the anterior wall. This is the vertebra, this is the umbilical vein. So this fetus is normal. This is the fetus number 2. This is the heartbeat. What is the heartbeat of this fetus? The heartbeat of this fetus ranges between, again, 150 beats per minute with regular waveform. This is the femur of this white, bright, echogenic line is the femur. No pathology seen relating to the fetus number 2. They can see the liver, the gallbladder. This is the liver, this is the gallbladder. This is the diaphragm. This is the diaphragm. These are the lungs, heart, urinary bladder. Now dilated though, and this is the penis, this is the X, Y, fetus. Now let's concentrate a little bit towards the fetus number 1. This is the fetus number 1. There is no pathology seen relating to the abdomen, vertebral column of this fetus. So this is in fact a case of twin pregnancy with hydrocephalus, that of the first fetus number 1, with loss of cortical mental. What are you seeing now? This is the tibia fib. This is the humerus and tibia fibula. This is the foot, heel, the umbilical cord. You can see 2 arteries, 1 vein. Normal. Is there any other associated finding with this? This is fetus number 1. Bas beta 2 minute. And this is the fetus number 2, the head of the fetus number 2. Patient is restless. He cannot, is asking to hurry up. She can't wait long. Enough. So I am going to almost finish here by showing you the head of the second fetus, so that you can make a difference between these two head and skull of and brain of the two fetuses, one normal, one with hydrocephalus. Yeah. Thank you.